Hi, my name's Anai, and I'll be teaching the proper way to take a patient's or a resident's temperature. I'll be teaching you three different ways you could take temperature, which would be orally, through the anus, and through the axilla, which would be the underarm. So let's get started. Super important things to keep in mind before taking a patient's temperature. You want to do the proper hand hygiene, which is the first step. Once you've done proper hand hygiene, you want to provide privacy for your patient. Super important. You want to provide full privacy for the patient. So that means you would want to close the door, or you would want to close the curtains. So another thing to do is you want to walk in the room, introduce yourself, and identify the patient. So in this case, I am using this is an example of my patient. So I'll give you guys an example of the proper way to introduce yourself and identify the patient. So in this case, I would be like, "Hi, my name's Anai. Today I'll be taking your temperature," and you'll let them know what way you'll be taking the temperature, which will be either orally, through the anus, or the underarm. And you want to identify the patient by asking them what's their name and their birthday, and then you want to check with their wristband. So let's get started. So today I'm using this is a regular thermometer that you use at home. I'll be using this as my example. Usually in a professional setting, you'll be using a more um the proper one. This one is not the equivalent one, but this will be my example. So the one that you will use at a hospital or residency usually will have like something sticking out, which where you will discard that piece out. So you'll want to discard that piece after every single use. It's super important to reject the piece out because you do not want another patient to use the same exact piece. It's super unsanitary. So in this case, I'll be using this one. Like I said, it's not the exact same one, but we'll make this one work. So this one is only for the to use on the middle of the forehead, but we'll be using this on other areas just for an example, but I will explain the proper way to use one. So let's get started. So you want to explain everything that you'll be doing to the patient to make them feel comfortable. So we'll go ahead and get started. We're going to do the orally. So you'll want to put your patient in a comfortable upwards position. You'll want to raise the bed and lower your rail. You will want to tell the patient if they could open their mouth, and you'll want to display the thermometer right under their tongue. So you'll put it under the tongue, and usually even the thermometer will make a ringing noise. I'm not sure if you could hear mine, but in this case it would make a little ringing noise, and when it does so, that means it has taken the proper temperature. So you want to put the thermometer right under the tongue, and once you put it under the tongue, you want to go ahead and keep it in place. You want to keep the thermometer right in place until you hear the ringing noise that comes from the thermometer, and it should show the patient's temperature. Then when it shows the temperature, you want to go ahead, remove it, and you want to discard the piece that you used on the patient, and you want to go ahead and place it back in the on the battery, because usually it'll come with a battery in a more professional place. So now I will teach you how to do the anus part. So usually, I am so sorry about that. So sorry about that. Okay, so usually you would want to get a lubricant ready for the patient. This case, I'll be pretending that this is my lubricant. So you would want to go ahead and get your lubricant ready. And you want to make sure to get some disinfecting wipes. I'll put this towel will be my disinfecting wipes as well. You would want to place them right next to you on the table. So then you will want to tell the patient that you will be moving them in the sideline position. You want to also help the patient move sideways, and make them feel comfortable. You want to ask the patient also, um, do they feel comfortable? You don't want to, force them to do something they feel very uncomfortable with. So you want to go ahead and then help the patient move sideways in the sideline position, and you'll let the patient, if they can't really assist themselves, to hold on the rail for support. So then um you want to try to not expose the whole body. So I'll cover my patient from here and only expose the area that I'll be taking the temperature from, which is the anus. So this is the you would want to clean the anus area with um a towel. And if necessary, you do want to provide probably perineal care at this time, but if not necessary, then you could go ahead and proceed. So then if the area is clean, you want to now add your lubricant to your thermometer. So in this case, you will have to pretend I have a piece at the end. This is where you put a lubricant. And you want to let the patient know what you'll be doing. So you want to go ahead and insert the outer piece into the patient's anus towards the belly button. You want to go about 1.5 inches deep. Do not force it in. If it feels like it's restraining, tell the patient to relax, to breathe in slowly, but do not try to force it in. It's very important. You want to not provide any pain to the patient. You want to make sure it's comfortable. So you want to go ahead and insert in about 1.5 inches. You want to hold it in place. Once it is in, the ring light comes on, and it will show you with the digital number of the temperature. You want to go ahead and remove it. Check the patient's temperature. Also, important thing, you want to let your patient know their temperature. It's super important to let them know as well. So then this is where you will press the button to discard that piece, say you would have right here. And you want to go ahead and grab a sanitizing wipe. And you want to make sure you sanitize the entire thermometer. Then you would place it back in the battery. And then you will want to grab a clean towel, and you would want to help the patient remove any excess lube from that would be in the anus area. So I will clean the patient's anus area to remove any excess lube, and then you want to toss it out. Once you've done that, you want to go ahead and help the patient move back into position. And you want to make sure that they are comfortable. So then now I'll be showing you the third way to check the temperature, which is the axilla. So it's basically under the arm. So once again, you want to grab your thermometer with a new end piece. So then you want to let the patient know if they're able to raise their arm up, and you'll help them out if they have trouble. So then you'll want to raise the patient's arm up. You'll want to put the thermometer right in the middle of the axilla, and you want to tell the patient if they could put their arm right across the chest, and then you want the thermometer to be under the axilla, and you want to hold it in place until the digital light comes on and with the little ring. And then you want to go ahead and check the temperature, and you'll let the patient know as well their temperature, and you'll say, okay, perfect. So then everything will be fine. So then you want to go ahead and get your patient back into place. Comfortable, you want to put up in any rails back up, put the bed back into a comfortable position for the patient. You want to go ahead and ask your patient, are they comfortable? You want to let them know where the call light is at as well. Now this is where you want to go ahead and go on either your computer or where you write down any observations you made. You want to make sure you you write down or type down your observations that you made, either as maybe a high temperature or a abnormal type of temperature that is not in range with the patient. You know, if it's a high, super high temperature, you want to go ahead and tell the nurse at once. It's super important. And after you are done, you want to go ahead and do the proper hand hygiene once again. Super important. Before and after any procedure, you want to do the proper hand hygiene. And that is it. Thank you.